We are in a mental health crisis, and yet so many workers suffer in silence or don't even understand what's happening to them and press on to their own and others' detriment. Let's explore how to recognize some of the signs, get appropriate help, and even prevent some of the workplace conditions that can contribute to poor mental health. I'll be citing a lot of statistics and resources because I am far from an expert, and these issues require professional care.
Hi, I'm Jenny Clark, a conscious leadership expert who spent 2 decades in executive recruiting and talent management. Having worked with giants like Google, Spencer Stuart, I discovered that the secret to transformative leadership lies in the 5 dimensions of conscious leadership. And I'm here to help you unlock your full potential. Join me on this channel as we embark on an honest and vulnerable journey together to become the kind of leader that genuinely inspires organizational transformation.
I have a few ways that you can get involved in this conscious community. First, I've created a free career map to help you uncover your next career move. Second, I've created exclusive content for you with a community of like-minded leaders. And lastly, I send out a free newsletter every week. To learn more, check out the description of this video. According to Gallup, nearly 1/5 of U.S. workers, 19%, rate their mental health as fair or poor. And these workers report about 4 times more unplanned absences due to poor mental health than do their counterparts who report good, very good, or excellent mental health. Generalized across the U.S. workforce, this missed work is estimated to cost the economy $47.6 billion annually in lost productivity. More than the economic cost, the toll on the entire workforce is exponential when considering the possible diminished capacity of those suffering, the additional burden on those picking up the slack, and the trickle-down effect seems endless. What can you do? Start with yourself and get good at spotting early signs in others. I grew up in Southern California. My mom, dad, brother, and I drove up to the Bay Area at least a couple of times a year to visit my father's family. We would gather at my grandmother's house, and someone would have to go pick up my aunt, Marcia, who lived at the YMCA. She was gentle and kind, and usually busied herself with ironing while we nibbled and chatted in the kitchen. I was always baffled as to why she wasn't more engaged and didn't live with the rest of the family. My father never spoke of it. My mother did her best to offer an explanation once I got into my teens. I don't recall the words. She might have referenced a nervous breakdown, but I understood that she had psychological issues that led her to leading a different life from the other family members. I'm recounting this story because in many families and cultures, there has been and still is a stigma associated with the family member who seemed off, different, troubled, crazy, or disturbed, or any number of other insensitive or misleading terms to describe mental disorders or mental health conditions. These people suffer in silence, and their conditions often worsen because they were never receiving appropriate treatment. By the way, according to one source, an estimated 20 to 25% of the unhoused population in the United States suffers from serious mental health issues, compared to only 4 to 6% of the general population. Fast forward, I have younger family members who are part of Generation Z, Gen Z, and who have struggled since grammar school in some cases with low self-esteem, bullying, questioning of sexual orientation and identity, some or all of which seems to have led to mental health conditions that showed up in a variety of ways. I'll share some of the signs shortly. According to one study, 9 out of 10, that's 90% of Gen Z with diagnosed, and let me be clear, said diagnosed mental health conditions struggle with anxiety, 90%. And nearly 8 out of 10, 78%, are battling depression. Now, I watched some of these family members struggle with these disorders and was involved in the treatment. It's so hard to watch your loved ones suffer with something that you don't necessarily understand or can see. It's not like another physical condition that you can treat and you're cured. This one can be hard to spot, treat, and eradicate, if ever. According to the World Health Organization, a mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It's usually associated with distress or impairment in important areas of functioning. Here's some key facts from the World Health Organization. 1 in every 8 people in the world live with a mental disorder. Mental disorders involve significant disturbances in the thinking, emotional regulation, or behavior. Effective prevention and treatment options exist, but most people do not have access to effective care. In 2019, 1 in every 8 people, or 970 million people around the world, were living with a mental disorder, with anxiety and depressive disorders the most common. And don't think that senior leaders are exempt from suffering from mental health challenges. Rank, title, and compensation are not barriers to the stresses that can contribute to mental health disorders. In fact, the added responsibilities and attendant stress are what can contribute to the likelihood of such issues. A report by Oracle and Workplace Intelligence surveyed 12,000 workers, including HR leaders and C-suite executives across 11 countries, and found that 53% of C-suite executives struggled with mental health issues in the workplace, compared to 45% of employees who said the same. Here's some lessons. Self-care. While a healthy diet, working out, getting regular massages can help, I'm suggesting a deliberate meditation or mindfulness practice to stay more in touch with your mental, emotional, and physical well-being, and even counteract some of the insidious stresses that can trigger or exacerbate a situation. Watch the signs, keep an eye on people on your team who might be showing signs of stress. Here's a partial list from the Mayo Clinic. Confused thinking or reduced ability to concentrate. Excessive fears or worry or extreme feelings of guilt. Withdrawal from friends and activities. Problems with alcohol or drug use. Excessive behavior, hostility, or violence, and suicidal thinking, just to name a few. Get help. According to experts, these conditions don't correct themselves. Start with your primary care physician, who can refer you to a psychiatrist or a psychologist for diagnosis and treatment. There is no shame in getting help for what is a legitimate health issue. Your employer's health benefits should include coverage for these types of disorders. So here's what I want you to take away from this discussion. Don't underestimate the repercussions of diminished mental health at work. Seek treatment, get diagnosed, watch the signs in yourself and others. Some indicators are hard to detect, so learn more. I really want you to show empathy to yourself and others struggling with a mental health disorder. There is no shame, and don't suffer or allow others to suffer in silence. I know firsthand how taking that first step can be the catalyst for a life-changing transformation. I remember the moment I decided to harness my own strengths, and it made all the difference in my career. That's why I've created a career mapping tool just for you to help you uncover your unique competencies and leverage them to design your own career map. Take the first steps toward your next level by clicking the link in the video description, and let's start this incredible journey together.